Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. We are honored today to have Shaiba Ansari-Ali, and I'm so pleased that she's been willing to join the podcast and join us as a guest and share her story. Shaiba, do you mind introducing yourself to our audience?
Sure. My name is Shaiba Ansari-Ali. I'm a rheumatologist. I work in the Chicago area. I was born in Athens, Georgia, the same place where REM is from.
Nice.
I was raised largely in Iowa in the Midwest and did all my schooling here, Michigan for med school, fellowship at Loyola, and here I am.
That's a good synopsis. Very brief. I'm sure that describes a very long process of deciding and becoming and that kind of stuff. Well, so kind of walk us back to the beginning. You know, you ended up as a rheumatologist in the Chicago area, and yet you started in Georgia. Did you always envision living in an urban area?
Well, you know, I'm the first generation immigrant. I'm the oldest child. So that's how my father got his PhD.
Huh.
And then we moved to Minnesota when I was young. And then we moved to Iowa, and that's where we settled there. And he actually was a professor at Palmer College, which was a chiropractic college. It was like the Harvard of chiropractic colleges back then. So he was a professor there. So that's where we grew up. We grew up in the Quad Cities. It's kind of four small cities right around the river. I lived in Bettendorf, and I did my undergrad at Augustana College, which is a liberal arts college. We only had like 1,200 students in the whole college at that time.
Oh, wow.
So that's where I did my undergrad in pre-medicine. And then I did medical school at University of Michigan in Ann Arbor. And I learned very quickly that I had to embrace the colors blue and yellow, but I have to hate red and white together because there's some rivalry going on there. And then graduated from med school, went into residency, but moved back to the University of Illinois in Chicago. Moved back to Chicago because I wanted to have a family and I needed childcare. And I have a lot of family in Chicago. I didn't have very much in Michigan. So moved back to Chicago. Started off as an OB-GYN, actually, for about a year.
So you did a residency, a 1 year of residency in OB-GYN.
Because 6 years into it, I'm like, yeah, I'm not going to do this. Because I delivered like 36 babies in like 24 hours. And I was like, no, I'm not going to do it. I was getting up at 4:30 in the morning to go around the hospital before surgery. I'm like, yeah, this is not the life I want. And then I'd see my attending there who was near retirement, you know, doing a C-section with me at like 4 a.m. I'm like, yeah, that's not the life I want. So I switched out of OB-GYN. I'm like, okay, I signed a contract. I can't leave these guys in the lurch. And I had good friends in the program. So I'm like, I'm going to stay the year. So I stayed the year. I learned what I could and kind of took it with me. And then I switched to medicine at the same institution, University of Illinois. I did my residency there. And then actually had a job all lined up as a hospitalist at one of the hospitals in downtown. And 2 weeks before I started the job, I did a rheumatology rotation with Dr. Swedler, who's like one of the best attendings that ever was. And he makes everything amazing. He gives you a backstory to everything. So he just doesn't say, oh, we're using this medicine for this. He'll say, you know what? This medicine comes from this and this, and studied in France. Like 12 people got better on it. So now we use it every day, stuff like that. So he always knew the backstory. So I did a 2-week rotation with him. I'm like, I want to do this. I don't want to be a hospitalist. I want to do this. So I went to my advisor, and my advisor said, you know what? Dr. Swedler makes everything interesting. So you have to go do a rotation with a boring rheumatologist. So then I
Make sure you really like it.
The boring rheumatologist, which will remain nameless. But I did that rotation. I was like, I still like it. And so then I went back and I did it. But by that time, you have to realize, right? A lot of people are for fellowship. They not match, but you know, whatever. They already have their spots in. So I decided like in the May of the year that I wanted to do rheumatology. So everybody said, well, go work for a year or do research for a year and then reapply. But then one person said, you know what? Why don't you just call up all the program directors in the Chicago area and just see, you might get lucky. And I did. I called Loyola and they said, you know what? The guy who was supposed to come here, he actually can't come here at the last minute with family crisis. He just called us yesterday. So if you want to come in and interview, you know, you're more than welcome. So then I went there, I interviewed there. And I guess there are 2 attendings there that are very, very different. And they both liked me. They always, if one liked a candidate, the other would hate it. If the other liked a candidate, this one would hate it like that. So I guess I was the only one that they both liked. And so I got the gig.
It was like a match made in heaven. You called right time and right place and right program. I mean, really, they were looking for you.
Yeah, about 6 days after I started my fellowship, one of my attendings was actually my partner in private practice now. And he said, I've been looking for a partner for 5 years. And you seem to be someone that I could work with. Why don't you come check out my practice? First, he asked me, what are you looking for? I said, I really want to 3 days a week. I have 2 kids. I don't want to make work my whole life. And so he said, well, come out, check out my practice. I'm looking for a part-time person. So within a week, I went and looked at his place. He liked me. I liked him. I liked his staff. We got along. And so a couple of weeks into my fellowship, I kind of had a handshake contract. And then I went from there.
Well, just your story thus far is a testament to the idea that we can change, because you went to school and then decided, well, OBGYN's the thing. And then you got partway through it and realized this is not the life I want, even though it's an interesting specialty. And then you got into medicine, and then you decided you want to do rheumatology. I mean, I think a lot of us look back and you kind of give like, oh yeah, I went to medical school here and I went to residency here and I got this job. And it's when you're at the beginning stages of a medical student, you think, it's just all going to be linear. I'll do this, but it's not. Most people, you ask them, and it's fits and starts and turns and unexpected things that come into your life. And you just have to kind of rise to the opportunities that come. And you did that even in your training years, which is pretty neat.
Yeah, I did. I switched a lot, but it just happened that it worked out. I'm a big believer in if something is happening easily, it's meant for you. If it's too hard, if you're getting too many roadblocks or too many good people around here saying don't do it, then just don't do it.
Yeah, well, I think often we're placed in places we need to be to help we only get to work for a few decades if we're, at most. And you want to be able to make the biggest impact, help the most people, and also be able to live your life. And it sounds like you've been able to find that match, which is wonderful.
Yes.
So
definitely.
I'm curious on your, you chose rheumatology, obviously, after working with a couple of attendings. You did the fellowship, and now into your practice. Have you found it to be what you expected? Do you enjoy rheumatology?
Oh, yeah. I love going to work every day. I do, because, growing up, I was an avid reader. And the best stories I read were Sherlock Holmes, which are the mystery stories. So it's where you pick up little details and you come to the right conclusion. So that's what rheumatology is like. It's like every patient is a mystery in the beginning. And I'm one of those people that I'll pick up a book and then I have to read everything by that author and then everything that author wrote about and stuff like that. And then found out that Sir Arthur Conan Doyle is actually Dr. Doyle. And Sherlock Holmes, the investigator, was actually based on his mentor, Dr. Bell. And that's what he used to do in class. He would stand people up and he would say, you come from this part of England and you do this and you do this and your family does this, and you just pick out little things. So he was an observationist, much like, Hippocrates or something like that. So he would actually, that's how it would come. So for him making the diagnosis was 90% was history and physical. And so that's what Dr. Doyle, he actually wasn't that great a doctor, but he survived. He was a much better writer. And so I grew up reading Sherlock Holmes, not knowing that. And then this kind of rheumatology is like that for me.
I'm a primary care doctor. I feel like at least half of my job is trying to investigate and figure out what is going on, kind of the diagnostic side of it. And rheumatology, when I get something that is like really bonkers and like, what is this? It's so many different things. I try to loop in my rheumatology colleagues all the time and say, help me diagnose because something's going on. And, sometimes it's not autoimmune, but sometimes it is. And they present with such interesting, chaotic findings.
Right. That's very true. And I like reading. And Lee had a couple of conditions. Lee is my partner, Lee Lichtenberg. And he had a couple of conditions for me joining him. And I think that really made my career very enjoyable. He said, one, you have to keep learning. So he's like, either you become involved in CME at Loyola where you trained at, or at another hospital, something, but you have to keep learning. You have to do something to keep your CME and yourself up to date. And then his second thing was, when you find good people, you have to treat them well. And so that was for our staff, for instance, all the other medical offices at Christmas time, whatever their staff would get like a nail kit or a manicure kit or something like a gift card or something like that. And we actually gave all our staff double paychecks every holidays.
Goodness, wow.
Which was huge for them because, he was always of the thought that there's enough money to go around. You're a doctor, you make good money. There are people that make less than you, and you're not going to get more poor by helping other people out. So he's like, there's more than enough money to go around. And so he was very pissed, but he made us put away like 25% of our earnings into retirement and stuff like that. He did a lot of that stuff too. He's like, you find good people and you treat them well. And then his third thing was he was very big on doing charity. So he was like, if you are a physician, it's your onus to give back somehow. And he said, what makes more economical sense is seeing a patient for free in clinic rather than going and doing a free clinic and wait, using up that 8 hours. So he and I would both see like one Medicaid patient or a free patient, a new patient, I think every 2 weeks. So it would work like 2 patients a month and they would kind of add up. But he was like, we all have that responsibility. So it's a communal effort. So those are his 3 conditions, and that kind of set the tone for everything.
I like it. It's almost like you hear people talk about the attitude of scarcity versus the attitude of abundance. And from your abundance, you say, let's bless somebody else with this, whether it's your employees or your patients. And I think that's good for a lot of areas of life. If you approach it from an attitude of abundance, I want to help somebody else, rather than scarcity where you say, I'm not going to share, I'm not going to go outside of my little realm. I think life is a lot more full and it's more rewarding. And, seems like money comes and money goes, but when you do something generous and kind with it, that means more than necessarily having more dollars in the bank.
It stays. And I think I was listening to your podcast with Brian Jepson.
Yeah, Brian's awesome.
And he was saying financial freedom, one of the markers of financial freedom is being able to give back or being able to do what you want to do for others and not being fearful of having to do that and not being fearful that it's going to affect your finances in any way. So I think these whole thing was, we have monies, we make good monies, we are financially secure, but we have to, it's not good enough for just our home to be financially secure. Everybody else should be secure around us as well.
Yeah. You've heard that phrase before where someone says, if you do a really good job, people will give you lots of pictures of George Washington to say thank you. In other words, you get dollars. But the point of it, the concept is that mindset of abundance to say, well, if I do a great job as a physician and I really take good care of patients and I'm more generous than necessary along the way, your financial house will be in order. You'll have all that you need because they will honor you by coming, and your business will be blessed from it. Whereas if you are really mindset of scarcity and you keep everything and you shut everybody out, it might look good for your finances for a few years, but it's not very satisfying as a human being. And I don't know that you really make more money by doing that. Financially, we do better when we're a mindset of abundance and generosity.
Yeah. And you always stress living within your means.
Yes.
Because I would see other doctors, especially, they'd buy the fancy cars and the nice jewelry and go on these amazing vacations. But monthly, they had kind of tied up their money so much so that they were working to meet their living expenses. And he was like, you have to live well. But then he's like, shouldn't make it about working to maintain a lifestyle. He's like, your work should be your work, but it shouldn't be there to maintain your everyday day things. He was very big on that, living within your means.
Well, and I think this conversation, about your career, and this is really informative because obviously you were taught to be generous and also taught to be careful and frugal with your finances because, we're going to get into it. You had a stroke at a young practicing physician.
Yes, I did.
You had something that was just crazy, unexpected at a young age, and it's so important to kind of have your financial house in order so that when something like that happens, you're a little bit prepared to weather the storm. So share with us what you're willing to about that crazy chapter of your life.
Well, so I joined Lee in 2006, 2007. I've been practicing for about 6 years. And you have to realize, even though I only worked 3 days a week then, we generated enough as far as a full-time practitioner. So we would each see, he would see a lot more, but I would see like 20 patients a day. That was just normal for us. He would see 30 patients a day. I don't know how he did that, but he would do that. So we did generate a lot of RVUs, et cetera. So in 2012, as they got busier and busier at work, and then I was also busier and busier at home, it's kind of like I didn't really have a place to recover anywhere. So I didn't manage my stress well. There's people that exercise and manage their stress well, and I wasn't doing that well. So I was getting more and more migraines. So from about 2012 to about 2016, I was getting more migraines. And I was getting like a cough variant asthma, but I didn't realize it. And I was coughing every 2-3 minutes, and I would catch a virus like in fall, and I would cough for like the next 4 or 5 months, and then it would go away, and then I would be like, I was sight out of mind, and then it would start all over again. And it was so bad that my staff, they didn't even tell me about this, but they would block like a week or 2 in my calendar, just not even tell me, because they know I'd be coughing so much I couldn't do clinic. And I was coughing to the point where, like, to give an example, because it's so nice to talk to a doctor because you know what this means. Like, I would have a patient come into the room, start the clinic visit, you introduce yourself, step out and cough. Come back in, ask a little bit of the history, step out and cough. Come back in, do the physical exam, step out and cough. Come back in, do the assessment plan, step out and cough. Come back in, ask, do you have any more questions? And so it was coughing like
a lot,
consistently, like a lot. Yeah. And I would go to the ER, they would give me some nebs and they'd be like, your oxygenation is fine. So I went to the ER a couple of times, they sent me home. But I just didn't realize that it was that steady. And so in 2016, I think I started off that year. I paid off my student loans, so that was a big one for me.
That is so cool.
And I actually took advantage of my parents for that. I took advantage of my parents because Lee was always like, you should always, try to look for opportunities where you can just reduce your debt. He was big about that. So my parents, they sold their house in Iowa and they were retiring. So I was like, you got whatever monies you get from the house, give it to me and I'll pay off my student loan, but then I will pay you back like thousands of dollars every month until it's like paid back within a year. I'll just do it like big way because I'd already bought into my practice. So I'd done buying into my practice and I kept my finances the same for myself. But then I borrowed the money from them. I paid off the student loan. And then I quickly, within a year and a half, I paid them back. And so going into 2016, I was debt free, which is great. Like from a student loan perspective, I was debt free. I had passed my rheumatology boards that January, and that was a fluke. I was supposed to take it later in the summer, but one of my friends was taking a review course and I went with her and I'm like, okay, fine, I'll just get it out of the way because we're both studying for it. Why not? And so I did that. And then finally, after paying everything off, I was able to save up enough money and we went on a trip to Disney World with me and my boys and my husband. So the four of us. And
how
it
fun.
was fantastic. I did all the rides and all this stuff. Yeah, it was great. And then that happened, I want to say in May. And then in June, again, I caught a virus. I started coughing at work. And one day I was at work and I coughed so hard that I felt like this electric shock go down my neck, but I didn't know what it was. And I just for a few seconds, but it was probably the worst pain I've ever had in my life. And then that pain stayed, but during the day, I wouldn't notice it because I'd be working, but I couldn't sleep at night. So being a rheumatologist and having doctor friends, I was on steroids, I was on muscle relaxants, I was on everything. At night, I just couldn't sleep, but during the day, I'd work. I would just keep working. And then about a week later after that, so July 1st, I was sitting at home and remember doing we see like 20 patients a day in clinic. So on Thursdays, I never had time to finish my notes. I would just bring them home. So Friday morning, sat down to do my notes. And that's when the room started to spin. And the weird thing was it spun two ways, like this way and that way. Like I don't know how to explain it. It's like being on the worst roller coaster in the world. And I don't like roller coasters. So I went to the bedroom. My husband got him awake and stuff like that. I threw up about 5 times. And then I said, I'm going to lay on the floor to get this. I must have vertigo. Because I'm 42. I'm like, it's vertigo. Then I thought, it's Meniere's. I'm laying on the floor. And I'm thinking, you may have Meniere's disease. And I was like, I thought that was like 50-year-olds. I'm only 42. What is this about? And then that's when I realized I couldn't move. Like I could feel everything, but I couldn't move. I was choking on my saliva. And I was like, wow, I'm having a stroke. And so on the inside, I was completely alive. I was having I could have live streamed this. And that's what I did in my book. I kind of live streamed the stroke. And I realized I couldn't move. So then I went back to, in my mind, medical school. You read about the diving bell and butterfly and the guy who had the, basilar artery thrombosis and locked-in syndrome. So I was like, oh my God, I'm having what he's having. And so then I remember just kind of the next day, I was kind of in and out. So got the paramedics in. I remember being on a stretcher. Then I'm out again. Then I wake up in the ER. Nobody knows what's going on. But the neurologist diagnosed me in 3 minutes. And then I wake up again. And then something happens in the dark. Something goes into my body, some electricity. And then suddenly I can move everything. I wake up in the cath lab. I'm intubated. And they're passing a wire up their brain to remove the stroke or whatever. And I'm like, okay, well, I got some of my feeling back because that guy has a really sharp scalpel and he's coming towards me to make a cut in my artery because I knew it was happening. I was like, God, I hope that doesn't happen. But then he came, he made the cut. They got up there, didn't find anything. Thank God is all gone by then. And because they'd given me TPA and then they had done that. And the big stroke, they had broken it up into 3 small ones. So I guess they ended up in my occipital and my cerebellar hemispheres. And so then I woke up again. I was in the ICU. I had a horrible headache and I was still on that roller coaster like sensation. But then the swelling died down, spent a month in rehab. And then when I was a month in rehab, the first week I had some complications. I was very irritable because where they had made the cut to go in the femoral artery to do the cath, that 1% of people that has the accessory artery on the backside of the femoral artery, not everybody has that. And so they had nicked that when they were closed up. So it was dripping blood on the inside. And so about a week later, I like bled like a pint of blood on the bed, and they coded and they carted me off to the hospital.
Holy cow,
And
Shayba,
then
this
surgery and
was a
everything.
saga.
And then I came back to rehab. But the whole time I remember that the doctors who were talking to me, I'm like, they must know I'm a doctor because the words they're using, if I was a normal patient, there's no way I would have understood that. And so I remember even in rehab, I asked the nurse, I'm like, I'm a doctor, right? And she was like, you're a doctor?
Oh, so they
Like,
didn't know
okay,
that.
there she is. You didn't know that. And so, because over the years, my patients had always said, you explain things very well in clinic that we understand. Because you have to realize in rheumatology, it's complicated diseases. And not only do we have to diagnose it, but explain it, but we have to start the treatment very quickly in some of these cases, especially if you want to save those kidneys or whatever. And they're very scary medications. And so my patients were always like, you explain things so well. And I was always like, yeah, I'm sure other doctors do too, whatever, this nice, you're a nice patient. But then when I became a patient, I realized what they said were true. The words that the doctors were using were things that I only learned after doing 8 years of medicine,
Right. They were speaking
And
doctor.
so
It's a different language.
they were speaking, it's a very different language. It's a very different language. And it's not about they wanted to do the best for me. They had a good intention, but I couldn't understand them. It's like speaking to somebody in a foreign language where you don't understand them. I could understand, but I know the other patients couldn't. So I did a month in rehab. And then after that, went 2 months at self rehab at home. And as a doctor, I kind of did what I wanted to do. And then month 4, I was able to go back to work. But remember, I could see 20 patients a day. Now I could see like 4. And it was taking me an hour to see each patient.
Also
And it was
significantly
very
slower.
draining mentally, very mentally draining because I lost the ability to write. I can't write now. I can make
Even
letters
now
and
today,
stuff, but I can't write
you still
fast.
can't write
I can't. No. So I type everything, or I'll like if I have to order it. I can't read my own writing. I write like a doctor now. Like before, I got a prize in 5th grade for my writing, Peter. This is very important to me. I could write very well, and now I couldn't write at all. So in clinic, I'll write L for labs or X for X-ray. I'll make scribbles, but then I have to dictate that very quickly once I get back to my office because in 5 minutes I don't remember what I wrote and I can't read it. But yeah, so I couldn't write. I've lost some of the hearing on the side. I've really loud tinnitus in this ear as well. It's like a jet engine is right here when I'm talking to you. That's like that kind of sound. And then I had trouble with balance. So I had to learn how to give injections with this hand. This hand became stronger for me.
You had to learn
I had
to
to
do
learn
it
how to
with
do that, even with typing.
your non-dominant hand.
With the other hand, non-dominant hand. I had to learn how to type more with my non-dominant. I had to learn to do a lot. But then it's all about repetition, right? It's all about repetition. So, I was in rehab. I learned about Frankel's ladder, the forgotten father of rehab medicine, taught everybody I know that because I like to teach. So I was teaching everybody about it. But then I really read up on his techniques. And so then his whole thing was whatever you're going to do for rehab, do it quick and do it like 1,000 times over. So I printed out 500 tongue twisters from the internet and I would go them 3 times a day. And the ones that were difficult, I would keep, and the ones that were easy, I would remove from that pile. But I did that for 2 months to clear up my speech. And I learned I have to move my tongue differently on the inside to get the right sound on the outside. So to me, I feel like I'm slurring, but people in front of me say, no, you're not. But I feel like I am because I know I'm living it differently. But it was that kind of stuff. It was that kind of stuff. A lot of self-rehab. And so then in 2020, I had always been medical education because I'd like to teach, even as a fellow and stuff like that. So I went back to work in 2016. I had the stroke. 2000, maybe 3-4 years, I just kind of gelled. And then about a couple of years ago, before the pandemic, I think, I started this series at work called Mansplaining Rheumatology because my staff would always come to me with the same questions over and over again. Like, dude, I told you this 5 times already. How could you not know this? And so then I started this series where it was just once a week, 5 minutes during the lunchtime, where I would just go through a rheumatological disease and I was put in the history, like Dr. Swedler, like this is how it started, and this is how we got here, and this is what we do, and this is why we do it. And they loved it. And then I turned that into like a YouTube thing in 2024. So I did medicine in 2024, and now in 2025, I'm doing rheumatology. So during the COVID, because that telemedicine, right, I had more time. So I wrote that book, and I hate writing. I really, really hate writing. It's like one of my heroes, George Lucas, said, it's like bleeding on paper for me. So I would write a line a day, and then it took me 8 months. I wrote a line a day, and at the end of 8 months, I think I got like a 17-page document on WordPerfect, and then I turned that into a book.
Well, so tell us about that. I mean, I want to reflect a little bit on unpack this because you have shared this crazy story at age 42. You got pretty devastating stroke. I mean, you got hemiparesis, you had cerebellar
Yes.
involvement. With that, it sounds like ataxia, language involvement. I mean, you really had
Yes.
a significant amount of rehabilitation to rehabilitate your speech and your ability to walk and get around. And you still have deficits to this day. But how cool is that you were able to go back
Yeah.
to work and find some ways to do it? And even though writing is obviously very challenging for you, but you were able to write your thoughts down over a period of time and kind of get your words into more of a concrete statement so you could talk about it. What's the book called? What did you write?
It's called When the Doctor Has a Stroke. It's a very short book because what I did was when I wrote the book, I'm like, I don't like writing, but I like TED Talks a lot. Kenneth Robinson was one of my favorite speakers. So I like this. So I read a book about TED Talks, like how to make the perfect speech. And they were like, only make things that are 17 minutes long because after that, people don't, they lose interest. And so that's why this book on WordPerfect was 17 pages. I kept paring it down until the 17th page. So I made it so that it's something more geared towards the patient. So it's very simple words, but anybody can. It's kind of like one of those Warner Brother cartoons where it can be, your audience can be at different levels, right? So it's that, but it's for a patient to read that takes like 20 minutes. Basically, what happened to me, live streamed the stroke, and then how I rehabbed and how other patients can do what I did just as easily, and hopefully get the same benefits. So it was one of those things where I had to do it.
Well, so where can people find that book?
Well, it's on Amazon. So I am BI before the internet. I'm BC before the computer era, right? So I Googled my way through this. It's on Amazon. So I self-published it on Amazon back in 2020.
When the Doctor Has a Stroke.
I kept revising it. When the Doctor Has a Stroke.
Yeah. Well, and I want to hear a little bit about you. You said you felt that you had to, or you were compelled to write the book, and it sounds like it was focused, or the intended audience wasn't fellow physicians, it was your patients, or for patients who have been through challenging circumstances.
Yeah. It was for both ends, I think, just to see it, because being like I was intubated and awake. I was in these positions, so I wanted the physicians to kind of see how they looked to me, but then I also wanted the patients for the patients, it was more the rehab part. Like, this is what you need to do to get back to hopefully where you were. And for physicians, it's more like, this is what your patient is saying. But it was kind of like, that quote by Muhammad Ali, the boxer, right? Where he said, his service to others is the rent you pay, right?
Mm-hmm.
Or your room on earth,
mm-hmm.
something like that. So you have to give back. So I feel like the universe, like literally everything lined up, like having that neurologist there who knew what he was doing, getting the TPA in time. Because if I'd gone to other hospitals, I had neurologists tell me that we would never have given you the TPA because he had a vertebral artery dissection too. And I guess you don't do that in that, whatever. But having the right neurologist, having the right care, having the best family and that support and all that stuff. So everything kind of, and Marion Joy is our local rehab place here. It's one of the best. So I was able to go there. They are now actually part of Northwestern where I work at. So they did a really great job. So it was a lot of things just kind of came together at the right place for me to have the stroke, but then also for me to recover, right? I felt like I had to get back.
You felt compelled to share your story, not just to like say, hey, this is me, but to tell doctors, hey, this is how it's perceived. These are some, when we speak doctor, not everybody understands. And to be intubated and be conscious and alert is a unique experience nobody wants to have. And to be able to relate to your patients or to other patients who experience really severe issues and say, there is a way forward. And these are some steps that I took and maybe you can too. I think that's neat that you felt not only the compulsion to do it and the desire, but then you actually did it. You wrote a book, and I'm sure it's benefited those who have read it.
It's a very short read. It's like a 20-minute read. Basically, I didn't know how much a desire I had to do health literacy stuff. I didn't know that was a thing for me because I did my research project and fellowship on health literacy, like what prevents lupus patients from getting the right care and stuff like that. And low health literacy was a big one. But I become more and more interested in that. So that was why the YouTube channel, that's why I go to stroke survivor groups. I go to my local senior center. That's why I'm giving these talks, just to hopefully, because I always thought, when patients said you explain things well, I always thought like, oh, they're just being nice. It made a scary situation less scary. That's very nice of them. But when I became the patient, I realized that's what they're saying is right. Doctors don't explain things because we're way up here, which is great education wise. But really, my rule of thumb is if my 13-year-old nephew can't understand it, my patients can't either. So that's the rule that I make in my head.
That's a good way to think about it. Communication implies that both people are receiving the communication. And so if you speak in high doctor speech and you talk to somebody that doesn't speak basically that same language or have that vocabulary, the communication is not really happening. You're saying it, but the person you're explaining it to is not receiving it, and therefore communication is not happening. It's good for all of us to kind of check ourselves. Am I using words that a 13-year-old would understand? Am I explaining it in such a way that the person is going to go home and be able to explain it to their family? Because I think that's when good communication happens, the person who received the information should be able to then explain at least the basics to somebody else. And if they can't do that, then we haven't really communicated effectively. So I'm glad that you were able to explain that.
And then when I did the research thing at Loyola in my fellowship, most people's medical literacy is at 8th grade level. Mm-hmm. So that's usually about 12, 13. I mean, they may be very educated otherwise, but their health literacy or their medical terms that they know is at an 8th grade level when you think about it. So that's kind of where I got that number from.
And it sounds like you started this YouTube channel.
And it's a present. It's a present to yourself, right? As a physician, if your patients understand what you're saying, that makes them more compliant, which means less complications, which means you can sleep better at night, right? Mm-hmm. So it's a present to yourself if you can communicate effectively with them.
What's your YouTube channel called? You talked about mansplaining things to your staff. I wondered, what do you call your YouTube channel to explain things? I think that's a good idea.
Okay. It's called Mansplaining Medicine, and because I was mansplaining rheumatology for the staff, and I ran this by the Mansplaining Medicine title. I ran it by like the 20-year-olds that I knew at the time, like my sons and their friends and stuff. Like, is this like, in this day and age, is this like inappropriate to use this term and stuff like that? And some of my patients, it's funny, my older patients love it. And my patients that are like less than the age of 50 love it, but that category, like 50 to 60, they don't like it at all.
Oh, really? Interesting.
But they perceive it as paternalistic or whatever it is, But it's not meant to offend anyone. It's nothing like that.
No, it's like tongue in cheek. It's kind of funny.
Right. It was just funny. It just it was funny, and it kind of. I think it makes younger people want to click on it more, because they're like, oh, what's this stuff? Because they're interested. That's what my son said. And a lot of my son's friends are like subscribers. So I said, it's so weird when I see a YouTube video sent to me and it's my mom speaking about something. But yeah, so that's how it started. So I did a series called Mansplaining Medicine all last year. And I'm the type where if I find something difficult, I'll do it first and I'll do it more often until it becomes easy. So the Mansplaining Medicine videos, I was releasing one per week. So it was a lot of writing, a lot of photoing and editing. And then rheumatology this year, now I'm doing one YouTube video every 2 weeks. So I'm taking 2 weeks time to write it out and edit it. Because even though it's more like a 4 or 5 minute video, they're not very long. I think the longest is like 10 minutes. They're not very long. The idea is that they take a lot of takes behind the scene because I slur. So I have to do it at the right time of the day. I have to make sure I have everything, and I have to do it from memory. It's not something I can read off of, so I have to practice. So it takes a while.
Yeah, I had a podcast guest a while ago, Eric Arzubi, another awesome person. He talked about the idea that we can scale our impact, and that's what you're doing. You're saying, okay, I have learned how to communicate. I've learned how to write and explain things, and instead of just having it affect those few patients who come and see you, you're scaling that impact to say, here's what medicine is. Here's information for people that could use it. Here's information that can be useful for doctors and patients. And so you are kind of scaling that impact. I think that you are a good living example of that.
And I'm going to go all fangirl here. I love Eric Arzubi's.
He is so cool. Yeah.
I think they're so great. And I listen to his podcast with you. I mean, he's just such an amazing person. And, what he did and the choices he made is just like a testament to how good his heart is in the right direction that he's going in. So he's like one of my people that I follow on LinkedIn all the time, and I'm always reading his stuff and commenting on it if I can. But I think that's, that word, that terminology they use, right? Scaling
Scaling your impact.
Scaling your impact. Mm-hmm. Scaling your impact. Yeah. And that was the thing. Because when I wrote the book, Amazon has this rule that you have to price your book at this minimum level or else they won't print it. And I didn't want people to have to buy my book to be able to read it type of thing, or that's the only way they're going to get this information. So that's why the YouTube is free, right? It's free for everybody. So then that's why I started doing the YouTube stuff, because I wanted more patients to be able to get it without having to financially themselves at risk or pay for it per se.
So with this journey, you've gone through being a doctor, being a patient. I've shared pretty openly on this podcast. I've had similar experiences being a patient and being a doctor, and it's kind of hard to wear both hats the same day, but sometimes that's just how it is. I wondered, what are some of the key takeaways you would tell some of our audiences? Think about, what is it like to navigate those waters between both worlds?
I would say how in residency and medical school, we compartmentalize really well, right? When we're on a shift or on a call, we compartmentalize. We're taking care of the patients. So be in that moment, do your day job. But then when you're at home, do your home job. And try not to mix the two too much. And try to get it work-life balance where, I do clinic 3 days a week, but I teach the rheumatology fellows at Loyola a couple of times, 1 day a week or every other week. I do lectures for the medical schools. I do things that I like to do. I'm doing these YouTube videos. I do things outside of just work. Not everything has to be just about work. So making your schedule such that your work kind of revolves around your life, not the other way around. That's what I would say. And number two, I think it's so important is just live within your means. Yes, you'll see your colleagues or whatever do these fantastic things, and that's great. But Lee always taught me, you really have that peace of mind the more debt-free you are, and the less debt burden that you carry. So if you can, give yourself some financial freedom that way. And that's, I've been lucky to be able to do that.
Thank you so much.
Two things that I would, and then the third thing is probably, I'm sorry, the third thing I was going to say is take care of yourself. Like that's the one thing I wish I'd done. Take care of your health. Because if you're not good, you can't help anybody else. That's just not going to happen.
Oh, those are good words of wisdom. I wanted to reflect back for a minute. I'm thinking back to my own experience when I had the tumor. I've shared on this. Like it was kind of a moment, a moment of a real great clarity. And, I don't know if the word is fear or just uncertainty. You don't know in that moment what's going to happen in the future. Am I going to be able to go and take care of my family? Will I be able to work? Will I be because you just don't know. And you kind of really boil it down to what really matters in my life. In those moments when you feel like everything is threatened, you say, well, what's important to me? It's my family. And the next step is, how am I going to take care of what's most important to me? How is my finances? And then what am I going to be able to do with the rest of my life? Because you just don't know. And you went through a similar process because you had an extensive rehab and you didn't know at the beginning what that was going to look like. I was just curious on your thoughts when that happened, when you realized it was a stroke and you went through it. How did you navigate that time of uncertainty and doubt and stress? Because it's such a unique, crazy, challenging time when that happens.
Whatever the stroke had knocked down on my brain and knocked out the part that worried about those things. So all the way through, I was like, I have to go back to work. I have to take call and decide. I was just so focused on that. But I think the biggest thing was one of my friends, she said, you're only truly irreplaceable to your family. Mm-hmm. She said, nobody else can be a mother. Nobody else can be the wife. Nobody else can be the daughter or the sister. But they are always going to hire another rheumatologist. So you have to learn how to prioritize. And I think when she said that to me, in my mind is like, when am I going to go back? And how can I modify it so I can go back? Because it's kind of like when you try to get into med school, like I didn't have a plan B. I know a lot of people, if they can't get into med school, they'll go into research or do other things. And I've had younger people come to me and say, what was your plan B? And I just didn't have one. And in this case too, I really didn't have one. I was always like, I'm going to go back to work. And Lee, when he was visiting me in the rehab, he said, you're too young to not work. He's like, you're only in your 40s. You got to keep working. You got to do something. And so my whole focus was coming back. There was no other option for me at that time. I don't think I'd ever gotten to the point where I thought I couldn't do this type of thing.
Well, I'm so thankful you were able to do that. It sounded like it took a tremendous amount of work because the rehab process is lengthy. I mean, I went through a big rehab process myself. And as you go through it, you have to be kind of laser focused on this is what I want. But above all, you made such an important comment. They can get a new doctor, but they can never get a new you. Your family is of highest importance. Yes. They will never have another person that can take the place of a mother, a sister, an aunt, all those things that are the most important roles of our life. And I remember thinking much the same, like, okay, I want to be a doctor. I want to be able to give back. And if I could do it again, I would want to be a doctor, all those wonderful things. But the very top of the list is I need to be around to raise my kids. I want to make sure that I'm a good husband, a good father, a good uncle, a good son, all those things that really matter when you think about your own life and what really matters. I think when you look in hindsight, you say, well, I had a great career and I had a good job, but more important than that was those relationships, the things that happen at home. And I also thought it was great that you said, you chose your whole career so that you could work to live and not just live to work. You made it so that you could have a little bit of adaptability to make sure that you were able to be an excellent parent.
I hope so.
Yeah.
I hope I'm an excellent parent. I hope that turns out that way.
Well, that's what I hope too. Yeah, for all of us.
We'll see. Cross everything.
We don't know how they're going to turn out. We hope that I've got 4 kids. I hope that so far they're doing great, but I hope that they will continue to make good choices. And, I hope that I still have impact on them. You never know how much impact you really have on your kids until years later. But, well, so Shaiba, you shared this wonderful experience. I feel like, just some points I'm going to take away from is live frugally and so that your finances are in order, work to scale your impact, meet your patients where they need to be met, as far as, how we communicate and you can relate to patients so well because you've been a patient and a doctor. And I think that those are lessons that I will take away from this. And I hope all of our listeners will also take that away as they've listened to this. Do you have any other thoughts or anything else you would want to share with our audience as we kind of wrap up here?
I would say, when you're in residency, you live like at the poverty level, right? And when you're in fellowship, try to keep that fellowship lifestyle for a little bit longer and just pay off as much debt as you can. Try to pay off your student loans. It just helps so much more because you don't know what's going to happen down the line. So just, pay off whatever you can in those lucrative years when you're making a lot of money. Just bite your tongue for another 10 years and just do it. And then that way you don't have to worry as much. Because if I had a student loan now, it would be horrible. Just try to be debt-free hopefully, or be less debt in your 40s if you can.
That's true. You wouldn't have been as comfortable cutting back your patient load or your hours if you still had a big debt that you were paying back.
No, not at all.
Well,
not at all.
Thank you so much for sharing. Like, I think the real lived experience that you've shared is inspirational. There are just only so many physicians. And so other doctors who may be going through a hard time can listen to this and draw some inspiration and say, okay, well, if Shaiba can do it, maybe I can do it too. So thank you for sharing. I appreciate you taking the time to do that.
Well, thank you for having me. And it's so nice to talk to a physician because you know what I mean when I say things like live like you're a fellow.
Oh, yeah. No, we all understand it. Well, thank you so much, Shaiba. You keep in touch. I appreciate it. Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.